Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsay Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Welcome back to the Endo Kids Podcast. I'm Dr. Rinku Mehra, your host, and today we're talking about something that affects growth, hormones, diabetes, obesity, behavior, and even puberty, sleep. And I'm so excited to welcome Dr. Funke Brown, the founder of the Restful Sleep, to talk to us today about sleep. So Dr. Brown, thank you so much for being here.
Thank you so much for having me, Dr. Mehra.
Yeah, so before we dive into the science, I wanted to talk a little bit about your journey. So what drew you into sleep medicine or pediatric sleep medicine?
Yeah, so with my own experience as a student who struggled with sleep issues and then became an adult who struggled with sleep issues and then became a doctor who struggled with sleep issues and then a mom who struggled with sleep issues with kids who didn't sleep. Really, that was it. So just really understanding how sleep impacted my entire journey made me, double down on improving it because I just wasn't the best version of myself without it. And so once I was able to discover sleep, literally, as I call it, my superpower, I decided to help others achieve better sleep. And so I went ahead and got additional training on helping both kids and adults sleep better.
Tell us a little bit about why sleep is so foundational. I think many parents see sleep as like a routine issue, but not really a medical issue. What can you tell us? Like, why is sleep such a critical pillar of health in childhood?
Yes. Sleep is so important. We spend a third of our lives sleeping, right? If you are younger, you spend more time sleeping. As you get older, maybe 7 to 9 hours. But when we do the numbers, a third of our lives is spent sleeping. And this has not changed. Because during sleep is just not a passive issue where if the day it's dark outside and there's nothing to do and then I'm just going to sleep is actually a very active process. Your brain is actually pretty active during sleep. It is filtering away any waste products that may have deposited on your brain during wakefulness. It is filing away memories. It is helping with emotion regulation. It is helping with your memory consolidation and creativity and so many other things because of the different levels and the stages of sleep. They play different roles. And then when it comes to your metabolism, your metabolism is getting better regulated with the hormones and things like that. All of that is occurring during sleep. And then your heart health, your blood pressure, your heart rate is supposed to drift down a little bit when you sleep. And that really, again, helps your heart stay healthy. And so many benefits, your digestive tract, everything is really sort of resting, but also recovering during sleep. So it's so foundational to everything that we do.
How do you explain how sleep architecture differs really between toddlers and school-age children and teens? I mean, I get a lot of questions about, how much should my teen be sleeping or how much should my school-age child sleep? What do you tell parents with that?
So, yeah, great question. So sleep needs vary with age. So typically when we think about maybe newborns, they get anywhere from 14 to 17 hours of sleep. And then we get into more of our toddlers, right? Where they are sleeping anywhere from about 12 to 14 hours of sleep. And then our school age kids, about 10 to 13. Our preschoolers more 10 to 13. And then school age kids, about 9 to 11 hours of sleep. And then our teenagers are about 8 to 10 hours of sleep. So the needs are changing because during the younger years, that's when a lot of brain formation is going. The brain is developing at a rapid rate, but we need sleep to promote brain growth. So that's why they spend most of the day sleeping, right? If you think about the baby or the first 4 months of life, they're awake, they eat, sleep, and then that's all they're doing because their brains are developing, the neurons are being formed. All of that growth continues even as they go all the way to adulthood. But those first few years of life, there's so much, it's happening so rapidly that we cannot afford for them not to get enough sleep. And so that's why the change. And then in terms of sleep architecture too, during the first few months of life, there's a lot of REM sleep, rapid eye movement sleep, which is a stage of sleep where dreams are happening, where memory consolidation is happening, emotion regulation is happening. We get a lot of REM sleep in the very first few months of life, and then the percentages kind of decrease over time. And then we start to get into more deep sleep as kids are getting older and they're getting longer. This is really the stage where growth hormone is released. And that's where some people will say if they have growing pains, because again, they're literally growing, right? So that's how we go. And then as you get older, you don't need as much deep sleep. And so your deep sleep starts to decrease. And then you start to get more into light sleep. There's just this evolution in the way the needs are structured, as well as the way your sleep is kind of built as you get older.
So, yeah, I mean, it really sounds like we really take sleep for granted, but I think sleep is so important in so many areas of our lives, really, from babies to adults and older people. And I think that's really important for people to understand that, we really can't take sleep for granted because it's
Mhm.
responsible for so many things. I think that's been your message. And that's the message that I've gotten from having known you for so many years because sleep is so important. But, let's talk a little bit about sleep and metabolism. Okay. So we know that poor sleep is associated with increased weight gain. What happens really when a child is chronically sleep deprived? What can you tell us about that?
Yeah. So first, sleep impacts everything, right? From the top of our heads all the way to our tippy toes is how I frame it. So when we think about brain health to start, right? Again, brain growth, development, learning, memory, mood, all of that goes south when you don't sleep well. Forgetfulness, inattention, hyperactivity, emotions become very labile when you have a child who doesn't sleep well. And you see that pretty quickly, right? A bad night of sleep, that's that child in the candy store or in the grocery store who's having a meltdown, right? That we'll see. And you can imagine over time, that becomes more of the impulsivity, inattentiveness, emotional ability. Before you know it, they have ADHD-like symptoms. Potentially, they could get that diagnosis. So we start to see that. Over time, we'll see, because again, during sleep, this is where the hormone regulation, growth hormone particularly, just one of the hormones, that's when it's secreted. So when kids are not getting enough sleep, they might actually start to have challenges with growth, whether it's gaining weight and things like that. Growth hormone even affects adults. People don't think about it, or older, like maybe older teenagers or teenagers as well, where even if you're not getting taller, but you can imagine if you have an athlete who's exercised, they've worked out, they've played all the sports, during sleep, that growth hormone helps with muscle recovery and muscle repair. So if they don't sleep well, they actually are more prone to injuries. They're more prone to falls, they're more prone to accidents and things like that. So it impacts it a lot. And then metabolism in other regards, some of these other hormones, insulin, cortisol, when you don't sleep well, it's not well regulated. And we start to see things like what we call impaired glucose tolerance and the higher risk of developing things like type 2 diabetes. Your body doesn't just respond to the way your glucose is being metabolized as it should. And so we don't see that right away, but over time, this is what we're seeing. And now we're seeing our young children struggling with conditions like obesity and things like that. And sleep actually plays a big role there too.
Yeah. So, I mean, what I'm hearing is really, should sleep be every part of a treatment plan? I mean, for me as an endocrinologist, I see kids with growth issues. I see kids with diabetes. I see kids with insulin resistance and weight. Should we discuss that at every treatment plan? What are your thoughts?
Yes, I am absolutely positive. And it's that thing that you get to do every single day. So when we think about the complexity of managing some of these chronic conditions, And you think about, well, if we can leverage this thing, right? We already have this child on this medicine, on this insulin, this medication. And we're saying, well, I mean, now you're at a point that we're not saying, oh, yeah, you sleep and all your problems go away. But if the sleep is not foundationally correct, it's like we're pouring water into a sieve. We're not just going to get the full benefit. So I would say, as part of our treatment plan, we're talking about how is your sleep quantity? How is your sleep quality? And helping, especially our younger children and our young adults and our teenagers, helping them understand that overlap. Because it's one thing for the parent to say, go to bed, go to your room, and another one for them to put their phone away and actually sleep. So
Yeah.
helping them see that maybe we won't need you to be on all this medication. Maybe we can come down on the dose because now your body's resting well and recovering well and things like that. So I think that conversation should be going on in every visit.
Yeah. I mean, I think that's so important. What are the most common sleep disorders that you see or that you diagnose in children?
One common one I see is sleep apnea. It often goes unrecognized. A lot of times children that present with snoring, teeth grinding, mouth breathing, sometimes they're bedwetting, restless sleep, they're waking up with a headache or just waking up tired. Those are red flags for sleep apnea. I also see a lot of insomnia where, for some reason or the other, they just have a hard time either falling asleep or staying asleep. And so that's something else that we see frequently. For our older children, we might see things like circadian rhythm disorders where their body clock is shifted later. And so they naturally cannot sleep well or fall asleep quickly. And then they have to wake up early to go to school. So they have chronic short sleep. Chronic short sleep leads to a lot of diseases down the line. So those are some. Also, restless leg syndrome is definitely something that I see with a lot of children as well, very frequently. One, again, sometimes it's because of their diet, so they're not taking enough iron in their diet or enough magnesium and things like that. So because of that, we might see restless leg syndrome as well. So those are just some of the more common conditions we see.
Yeah. And when should a child get a sleep study?
A sleep study, I would say, have a low threshold. If you have a child who is, again, snoring, maybe more than 2 or 3 nights a week, a child who has mouth breathing, restless sleep, or unrefreshing sleep, I mean, of course, we want to make sure the basics. Are they in bed at the right time? Are they, falling asleep in a room that's cool and dark? But if you're still noticing, wow, this child wakes up and is really tired, or when I go into the room, this child is breathing with their mouth open or is snoring, even if it's not heavy snoring, as long as they're snoring more than 2 or 3 nights a week, I would say get a sleep study because this is a condition that could potentially be very serious, but it's so treatable.
Yeah. So low threshold is what I'm hearing first. Sounds like.
Absolutely.
I mean, what are common, are parents missing that, do you think? Like mouth breathing or snoring? Are they just thinking that's the normal for these kids?
I would say both. Parents don't know what they don't know. They're not present or watching their child all night long. So I think that's where it gets tricky, which is why, again, pay attention to your child. How are they when they wake up? Maybe when you go traveling and you're not at home and you guys all share a bed or a room. What's going on there? What do you notice? So those are red flags that you could start to pay attention to. Unfortunately, also, sometimes they go to their regular doctors and their regular doctors just say, well, maybe it's normal. We just maybe watch it and things. So I would say you're the best advocate for your child. If you have any suspicion, definitely speak up so that you can get the treatment you need.
Yeah. I think that's so important because I think, like I said, I think some of these conditions are missed. Oftentimes we talk about them and I don't think they're prioritized as much. So that's what I'm learning is really to prioritize the sleep and some of these concerns. I wanted to shift a little bit and talk about sleep and growth because that's where my endocrine brain kind of lights up. I know we talked about growth hormone and growth hormone is really released during deep sleep. And I think you talked about that a little bit. If a child has growth concerns, should sleep quality automatically be evaluated? What do you think?
If they have growth concerns, as part of the evaluation, I would say, yes, you absolutely want to do that. And here's what makes things a little bit more complex too, because I've seen for patients who have growth concerns and maybe they started on growth hormone, you do have to be careful from a sleep perspective, because what we see in some children on growth hormone is their sleep. If they have sleep apnea or they have snoring or they have a risk of sleep disordered breathing, their sleep disordered breathing may get worse on growth hormone. Yeah. The reason why is because some of the tissues, like the tonsils, the tissues at the back of the neck, some of that also grows too when they're
Yeah.
on growth hormone. So if they have, and some in some situations, not all, but if you have a child who maybe has snoring or you're wondering, even getting a baseline sleep study before starting growth hormone might be helpful because we want to make sure that, well, if we start them on growth hormone, we're not potentially making things worse,
Yeah.
whereby we're now making their sleep apnea more pronounced. So if
Mhm.
there's suspicion, that would be another reason. If you're saying, oh, I have a child who's maybe having some growth issues, it seems like he snores, even though the snoring is not too much, and I want to start him on growth hormone treatment, then I would say highly recommend to get a sleep study because then we potentially don't want to give, as we're treating one problem, we don't want to introduce another problem.
Yeah, that's a very important point, I would say, and I definitely will use that as part of my, ongoing evaluation because I think
Mhm.
that it's so important. We do talk about certain conditions that are related to, worsening of that tonsillar growth, genetic conditions like Prader-Willi, but as a
Yeah.
routine, on a routine basis, I don't think that's something that we routinely do, and I think that's
Mhm.
a very important point to make.
Yeah.
Let's talk a little bit about teens
Mhm.
because that's a common time that we see some unique sleep phases. And as a mom now of two teens, I definitely have noticed that their sleep structure has changed from the beginning. And why do teens naturally shift to sleeping a little bit later? I mean, is it their biology? Is it their
Mhm.
laziness? Is it because of their growth? What do you
Yeah.
typically see or what do you how do you counsel people, parents like me of teens about their kids' sleep? Why are they sleeping longer?
Yeah, I mean, teens get a bad rap because of that, right? They're felt to be lazy, they're night owls, they're trying to avoid school, all of that. But we know that there's a biological change that occurs around puberty where there's a delay in what we call their internal clock or their circadian rhythm. And so your adorable, previously 8-year-old who would go straight to bed at 7:30 is now just wandering around the house at 11 p.m.
Mm,
And it's not because it's not always, I mean, the phones play a big role, but sometimes it's not always because they want to just be on their phones, right? Sometimes it's really naturally because their sleepy hormone, the melatonin, is now delayed in
mm,
terms of when it starts to rise. And so they can't sleep, they can't force themselves to sleep, and they may actually get insomnia if they try to force themselves to sleep. And so naturally, they have a hard time falling asleep. But once they fall asleep, they're able to stay asleep but they need to stay in bed longer. So the total number of hours of sleep actually may not necessarily change. They may still need 8 to 10, but it's shifted whereby now, they're not going to sleep until midnight, but they got to wake up at 6 a.m. and it's hard to get them out of bed for school and things like that. So the physiology is a big part of it. Of course, there are environmental things that play a role. The screens, social pressure, anxiety, or the fear of missing out, all of that also plays a role.
yeah. I mean, I definitely see that. And
Mhm.
I think it's important to know that, it's not just their laziness, some of it may be biology. I mean, so I think that's important for me also as a parent to understand that as I, navigate this phase of life with my kids. Let's get a little practical on sleep hygiene. If
Mm.
parents can implement three evidence-based sleep habits tonight, what would you suggest? What would they be?
Very good. I would say have a bedtime routine. That's something that would be huge, especially for parents who have maybe older children. Just clean activities heading in the direction of the bedroom. Avoid the screen exposures about an hour before bed. Again, just to kind of start to cue their brain that it's time for bed. And then I would also say that you want to make sure that that room is as cool and as dark as possible. So that's something else that can absolutely start to help with your child's sleep. For because light plays a big role, especially our younger kids because their cornea is much more transparent. So the light exposure from the screens and things like that impacts their sleep significantly. So those would be some of some of the top three things you can absolutely do. Make sure you incorporate a bedtime routine. Make sure that you're avoiding the stimulating activity of all the devices and the light and the blue light. Make sure that that bedroom is as dark and cool as possible.
Yeah. I mean, how do screens and blue light impact melatonin? Is that a delay rise or does it just not rise as much? Like what what is actually happening?
Yeah, it's more of a delay in the rise because Your brain responds to light. There's a spot in our brain. It's the suprachiasmatic nucleus. It's just a center. This is where in response to light that your eyes can perceive, send signals there to stimulate the production of melatonin or the decrease. So melatonin is your eyes perceive darkness and then send signal to the brain to say it's dark, and then melatonin is released, right? When there's too much light, it sends those signals again to say, oh, it's daytime. And so the melatonin is suppressed. And your brain doesn't know whether it's artificial light or daylight. It treats it the same. So it treats the blue light, like the phones and things like that, the same way it would if it was 12 noon. It just assumes that it's daytime. So it's a very tricky brain. Some parts of our brain still very primitive. It doesn't differentiate that, oh, it's night out, but you're just choosing to be on your. No, it just assumes, oh, it's daytime, so I don't need to be released. And so that delays melatonin secretion.
And so do you recommend putting phones away an hour before bedtime, 2 hours before?
I would say for kids, about an hour. I would say about an hour. If you have a child who has a hard time settling down, maybe they have ADHD, maybe look to keep them off their screens for even longer and provide alternative relaxing activities that they could do again so that they can wind down better.
Okay, good advice. And speaking of teens also, what about caffeine? Because that's another thing that we start seeing in teens. How big of a problem do you think that is with sleep?
Yeah, I would say for everyone, even kids, younger kids as well, because caffeine is a stimulant. And so it can help you with staying awake. So if you were sleepy and you take some caffeine, it might actually help you stay awake. So it can promote alertness. But the thing about it is it stays in our system for so long. What we call the half-life, the time it takes for it to be broken down, could be as much as 6 to 8 hours. So if you take it with dinner, you take iced tea with dinner, well, you're going to have a hard time either falling asleep or staying asleep because of it's still in your system.
Yeah. I think, that's also something that I think teens don't understand. And I think that's important, even for adults too, to emphasize that is making a big difference. I think this has been so educational for us. What have you seen in your practice? Like, what do parents do? Is there anything that parents do to help with kids' sleep that actually makes sleep worse? Like, if there's one bit of advice that you could give parents about what not to do, what would that be?
Yes, that's great. So I would say one of the things that you probably do, I mean, this really applies more to younger children. I'll say two things. Fading your child to sleep can make their sleep worse because your child may now develop an association that they need a bottle to fall asleep. That's one. Then two, for the older kids, thinking that if we wear them out at night, will make them go to sleep. Sometimes that can make things worse. That being said, physical activity is very important in promoting healthy sleep. But if your child's bedtime is 8 p.m. and then 7:45, we decide we want to go outside on the trampoline because we want them to be worn out, we might actually get them too revved up where they now have a hard time with sleep. So those would be things you just want to pay attention to.
Okay, that's great. Great advice. And then one of my last questions for you, I think I have so many questions for you because it's great to have you on the podcast. But, is melatonin safe? And I don't know if we're moving away from that, but I feel like over the past years, there's been some different data on melatonin plus or minus. So what do you tell patients or parents when they ask about melatonin?
Yeah, I would say melatonin, they've looked at safety in children with in children with neurodiverse conditions. And they've looked at its use over about 2 years. And relatively speaking, they were safe. Some side effects like bedwetting, nightmares, sleep talking, some of those things, daytime sleepiness. But I think more importantly is what you're treating. So many people just use melatonin as a Band-Aid solution. It's important to figure out what's the underlying issue here. Is there sleep apnea? Is there restless leg syndrome? Or is this just insomnia or delayed circadian rhythm? In which case, and every one of those conditions may not necessarily respond to melatonin except for the circadian rhythm issue. And I would say the dose of the melatonin as well as the timing as well matters. So it's not just melatonin, it's how are you using it, what dose are you using, and then for how long you're using it. So there's a lot to consider. And also understanding that it doesn't replace the behavioral strategies of helping your child learn to sleep well.
Yeah, I think that's a very good point. Learning some of those behaviors, I think, is the primary goal.
Yeah.
if parents remember one thing about sleep and long-term metabolic health from this podcast, what do you think that should be?
The fact that sleep is a core foundation, it impacts everything. It's a good place to start. And you get a chance to do it again tonight. Even if you don't do it right last night, you get another chance. And so not to make you panic, like, oh my goodness, my child's not going to grow because they're not sleeping, but to come from a place of empowerment and knowledge that, well, even as I navigate my child who might be having this endocrinology or metabolic condition, to say, well, this is something that we can definitely work on.
That's so great. I think this has been so educational for me also. I wanted to let parents know also that you are now seeing patients in Virginia, which is one of the areas that I'm located in. So can you tell people where they can learn more about your work and sleep support and how they find you?
Yes, absolutely. So our website is restfulsleepplace.com. So that's a great place to find us. We're licensed to see patients, both kids and adults, in New Jersey, Pennsylvania, California, and now Virginia.
Okay.
And so if you go onto our website, you could schedule an initial appointment or call our team. There's always someone on the line to help navigate and get you scheduled. So we'll be more than happy to see you.
That's amazing. And are you doing most of this via telehealth in other states, so in Virginia?
Yes, so we're offering telemedicine, exactly. I
Okay.
mean, of course, if you want to drive down to Horsham in Pennsylvania to come see us, you're more than welcome. But most times we end up offering telemedicine services.
Okay, great. Thank you so much, Dr. Brown, for taking time to talk to me today. I think we will, really, you provided so much education for our patients, and I'm always so delighted to talk to you because I think it's, you provide so much clarity on this important topic. So I wanted to take a moment just to thank you again for joining me today.
Thank you so much for having me. It's been a pleasure speaking with you.
Okay. And until next time, this is Dr. Mehra with the Endo Kids Podcast, and where little hormones beat big answers. And if you have any other questions or concerns that you want addressed, please send us a note. Thank you.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.